do you have an opinion as to whether or not Mr. Rovner could have had palpable pulses in his leg that night?
I do have an opinion.
What is that opinion?
My opinion is based upon the medical records from the emergency room, previous hospital records, records from the podiatrist, the foot doctor that was seeing the patient, the vascular surgeon that had seen the patient, and Dr. Goldstein, the family doctor who had been seeing the patient, that no palpable pulses, meaning feeling pulses with your fingertips, no palpable pulses had been felt in Mr. Rovner for years, long time.
And based on a history of no palpable pulses felt in his leg, did Dr. Lieberman correctly reach the correct conclusion on pulses? Or
in my opinion, she did not.
did she get it wrong?
She got it wrong, in my opinion, based upon all the facts that are in discovery, everything we know.
Wrong. And then, lastly, on the capillary refill, sluggish, it's in the nurse's notes. We talked about it. It wasn't in Dr. Lieberman's notes. But did Mr. Rovner have this sign and symptom consistent with arterial occlusion?
In my opinion, yes. Capillary refill was sluggish that night, or that morning.
And then, summarily, what was the relevant history of this patient that's consistent or makes a doctor like Dr. Lieberman, or should make a doctor, think arterial occlusion?
Well, we have the current history, that is acute, serious pain that woke him from his sleep. So we have the history of present illness. Why is he in the emergency room by EMS in the early morning hours?
Okay.
Next, we have the past medical history. Mr. Rovner, both in the medical records at the hospital, the medical center that day, as well as available through him and his wife, was known to be a patient with circulation problems in the legs. He'd had circulation procedures and circulation problems previously. He'd had surgery previously for circulation problems. He was a diabetic. He had recently been sick with a cough, cold, bronchitis type problem for which he had been put on Levaquin, an antibiotic, and Medrol. And you say, what's the significance of that? Many patients his age, when having a respiratory illness, will often become dehydrated or have less than normal hydration, and that's important. Also, the fact that he was on the steroids, I mentioned to you earlier, made him at risk for having high blood sugars, which can affect why he's presenting to the ER that day.
Okay. And then, was this all documented in the chart, these things that you had just discussed?
No. The fact that he had had surgery to his leg was not documented in the records. The fact that he had heart surgery in the past was, but leg surgery was not.
The heart surgery, is that referred to in the records as CABG?
It is.
And what is that for the benefit of the jury?
Those are initials that stand for coronary, which are arteries on your heart, coronary artery bypass graft. And that means that a surgeon has opened up your chest and has, again, bridged one of your arteries to the heart with a graft, a bridge, to restore circulation to a part of the heart that's not getting enough blood. And we call that a CABG, C-A-B-G, CABG.
And is that history of CABG consistent with the history, consistent with an arterial occlusion on 11/28?
Yes. Even if you didn't know, even if you saw the scar and didn't know what the fem pop scar was on his right leg, the fact that he'd had heart surgery for a blockage, 3 vessels blockage, would alert the emergency room physician that this acute onset of pain that woke him up from his sleep and brought him in by 911, artery blockage would have to be on your list of possible explanations.